In our first panel, the panel members will discuss how school-wide systematic approaches to identify, address, and monitor student and educator needs are essential to providing comprehensive and cohesive trauma support. We will provide a foundational understanding of what a comprehensive trauma-informed approach looks like and the different components of such an approach. I'm sure that you are all pros at using Zoom by now, but we wanted to review a few of the functionalities here. Throughout the panel, you can engage by using the chat to communicate with the facilitators and other attendees. Please be sure to select all panelists and attendees if you would like everyone to see your messages. You can use the Q&A function to ask questions of our panelists. We will monitor the chat and Q&A to address your questions and comments during and after the session. In addition, closed captioning is available by clicking on closed caption at the bottom of your screen and then show subtitle. We will also post a recording of this session to the Summit website following the event. And now if our panelists would turn on their videos. Welcome. We have three panelists with us here today. Marisa Del Rosario, a trauma-sensitive school specialist from the Trauma and Learning Policy Initiative. Jim Harris, the Associate Director of Training at the West Virginia Autism Training Center at Marshall University. And Jenny Spez, a professor of psychiatry and executive director of the Center on Trauma and Children at the University of Kentucky. First, you'll hear a bit from each of the panelists. They will introduce themselves and provide an overview of how their work contributes to a comprehensive approach to addressing student and educator trauma. Marisa will focus on the impact of trauma on student learning. Jim will focus on school readiness and multi-tiered system of support. And Jenny will discuss the role organizations can play in addressing secondary traumatic stress. Jim and Jenny's topics align with their upcoming presentations in the next concurrent presentation session. This panel will help you choose which one of those presentations you would like to attend. Marisa's colleague from the Trauma and Learning Policy Initiative, Joe Restuccia, will be giving the keynote presentation on creating trauma-sensitive schools for all students tomorrow. Following their introductory remarks, we'll have some moderated Q&A. At the end of the session, we will open it up to the audience for questions. If you would like to ask Marisa, Jim, or Jenny a question, please use the Q&A function at the bottom of your screen. And now I'll turn it over to Marisa.
Good morning, everyone. Thank you, Hannah. It's so nice to be with you all today. As Hannah mentioned, my name is Marisa Del Rosario, and I'm with the Trauma and Learning Policy Initiative. Our project is a collaboration between Massachusetts Advocates for Children, a statewide children's rights organization, and the Harvard Law School. Next slide, please, Nancy. Thank you. I wanted to just start with a little bit of context. And as the commissioner just mentioned, part of this discussion has to begin with the prevalence of traumatic experience for children in our schools. The slide on the screen relates to the Adverse Childhood Experiences study done back in 1998, which showed just staggering numbers. This groundbreaking study really proved the prevalence of traumatic experience, and since then has been replicated time and time again. And now, since the advent of the opioid crisis and this pandemic that we're living through, we know that more students than we ever imagined have experienced trauma. That this is not one or two students in our schools, but these are students in every classroom in every school. And that there are profound impacts, as the commissioner alluded to, in terms of students, which can lead to just a cascade of social, emotional, and academic difficulties in schools. Exposure to trauma can also lead to students adopting self-medicating behaviors, self-harming behaviors of great concern, and schools are uniquely positioned to mitigate these harmful effects and the impact of trauma. Next slide, please, Nancy. A trauma-sensitive school is one in which students feel safe and welcomed and supported and empowered to really engage and participate fully in all that the school has to offer. And throughout the summit and in the keynote tomorrow, there'll be more discussion about the creation of trauma-sensitive schools. But part of this is that the school really embraces addressing trauma and its impacts. And that's really centered at the core of the school's mission. And it's a place where educators, school leaders can engage in an ongoing inquiry-based process that really allows them to think about their own identified urgencies in their school community and address them through working together in terms of collaboration and teamwork among the adults in the building. Next slide, please, Nancy. At the Trauma and Learning Policy Initiative, we really believe that this ability for educators to come together to understand and deepen their knowledge and awareness about the impact of trauma, the prevalence of trauma in their schools, allows for the engagement in a process of looking for what is urgent in our school. What are we concerned about? What resources do we have available to address those concerns? And how do we come together and work collaboratively to address the concerns? And we know that doing this can really lead to educators beginning to have shifts in their thinking about how to approach students impacted by trauma, and also can begin to create shifts in practice in terms of addressing students' needs. And this becomes embedded in the culture of the school. It's just the way that we begin to do things around here. This holistic approach of creating a school-wide environment where all students can feel successful is the hallmark of a trauma-sensitive school. Thank you, Nancy.
Thank you, Marisa. Next, we'll hear from Jim.
Good morning. Great to be with everybody and sharing some information about how we are supporting this work in West Virginia and have sessions later on to talk more about this. What I want to talk about this afternoon, especially in the breakout session, blends perfectly with what Marisa was just talking about, which is really considering the idea of how we implement change in schools and how we bring on new ideas and new concepts and new practices in our buildings. Just to give you some context quickly, I'm the Associate Director of the Autism Training Center. Our Autism Training Center is housed at Marshall University, and we have 3 distinct departments. We have our autism-specific community-based services that we provide. We have a college program, which was the first in the country that supports students with the diagnosis of autism who are degree-seeking students at Marshall University. And we also have what is our Behavior and Mental Health Technical Assistance Center. So if we advance the slide. Our Behavior and Mental Health Technical Assistance Center is a department that is not autism specific, but is funded through grants from the West Virginia Department of Education. And we have 3 projects underneath that department. That's our school-wide positive behavior support project, our early childhood positive behavior support project, and our mental health first aid project. So in these 3 projects, our goal is to build capacity throughout the state of West Virginia and implementing improved support systems for kids with a variety of challenges, students with a variety of challenges, and to support staff and systems in this capacity building. So what I'm going to talk about this afternoon or at 12:30 is this idea of we often know what we want to do and we get excited about, we want everybody to be trauma informed. We want everybody to have, practices, and trauma is really important. And we get this enthusiasm around what. And what I want to talk more about is how do we approach change, which, like I said, matches nicely with what Marisa was talking about. How do we approach change? How do we think about change? Because too often, I think we have a sense of excitement, and that excitement gets ahead of, all right, let's take a step back and look at what is the culture, what is the readiness for change in this specific environment, and trying to unpack that. And the lens that I'm going to view is through the trans-theoretical stages of change, which originally came from health change behavior, but it's a lens of looking at where different groups or individuals in our buildings might be or in our districts might be in their understanding and readiness for change. We'll kind of work through this idea of, how do we get people thinking about change? How do we get people talking about change? How do we get people planning for change? How do we get people doing the effective actions for change? And how do we keep people on the track and maintenance of the changes that are in place and keep systemic consistency? And then if we happen to relapse back into things that aren't as effective, how do we help people remember the why and how to get back to where we need to be? So that's the lens we'll view it through, and assessing through how do we use quantitative and qualitative measures to assess the readiness for change and what change behaviors match the specific needs from what we're observing for individuals. And I'll take this through the lens of MTSS as well, the multi-tiered systems of support, and specifically our work around PBIS and school-wide PBIS, and how understanding trans-theoretical stages of change can really help us to implement PBIS in the most effective way possible, that prevents us from having what I would call somewhat this house of cards implementation, where we do the neat and fancy things that on the surface look like implementation, but actually have a weak foundation and aren't putting in place the systemic needs of students. So we kind of take a step back to allow for those meaningful conversations and allow for those foundational conversations and build those practices based on systems and sustainability. So hopefully folks will get to hear some of that this afternoon. Thank you.
Great, thank you, Jim. And now we'll hear from Jenny.
Thank you, Hannah. Thank you, Jim and Marissa. I'm Dr. Jenny Spez. I'm a professor at the University of Kentucky in the Department of Psychiatry, and I am the executive director of the UK Center on Trauma in Children. So, what that means is that I've had a couple of decades of experience as a researcher, as a center director, as a clinician, as a policymaker, thinking about the issue of trauma-informed care. And one of the things that I've noticed is that as trauma-informed care is kind of spread across the country, there's been a lot of attention to how do we apply these principles of trauma-informed care to our workforce. And this brings up a lot of questions about secondary traumatic stress. So as a reminder, secondary traumatic stress is when a professional, a teacher, counselor, school social worker, principal, starts to develop symptoms of traumatic stress because they're hearing the trauma details of someone else's trauma experience. And this causes a reaction that's very similar to what we describe in PTSD. So this could be from hearing trauma details from kids or their parents over and over. This could be that when you have to recount them to other professionals as you do your work, calling in child welfare referrals, talking to the school counselor, talking to senior leaders in your school, seeing graphic images that children may draw or that are attached to records, having to testify in court, or just really seeing the aftermath of trauma's destruction. These are kids that are self-harming, they're hoarding food, they're really dysregulated. And so these symptoms of secondary traumatic stress can range from really mild and transient to very severe, and they can be with or without functional impairment. So they can actually impact a way a person is able to do their job. And the people that have the most severe forms of these symptoms will meet the criteria for PTSD. So anybody who spends more than about 10 minutes looking at the literature about secondary traumatic stress will notice that a lot of the strategies and approaches for addressing secondary traumatic stress kind of fall into this category of self-care, wellness, and health promotion, which is really a shame because we have several decades of research that helps teach us, how to address trauma. So we wouldn't tell a client or a child going to our school that has PTSD to just go home and eat more kale and up the number of massages they're getting per week. So why do we think that those kinds of approaches would be sufficient for our workforce? Next slide, Nancy. So the elephant in the room, as I like to call it, is that for those that have even mild symptoms, we can't forget that individuals alone can't do this. They need to work in concert with their organizations. And schools play a role in addressing secondary trauma as well. And I think for far too long, the literature has ignored this organizational context and put, what I think is an unrealistic and unfair onus on the worker to overcome all of these exposures using techniques that were designed to deal with stress, not traumatic stress. So, for those of you who work with family systems, that even the most effective treatments in the world are compromised by dysfunctional systems environments. And it's the exact same with secondary traumatic stress. Next slide, please. So that's why I'm really recommending a bifocal approach to addressing secondary traumatic stress. So in my presentation at 12:30, I'm going to take a really deep dive into the specifics of this approach. And I'm going to describe some of these elements that are at play here at both the individual and organizational level that we can use to create positive organizational change. And I'm going to give you some examples of these strategies that you can use so that you can see we have a lot of tools beyond what my friend Françoise Metu calls the kale and pedicure approach to addressing secondary traumatic stress. And I'm going to address a study that I did that really answers this question about whether or not are things that schools do to address traumatic stress really able to impact school personnel on the individual level. So as a school becomes more STS informed, does this really decrease the secondary traumatic stress in the workforce? So I think this is an assumption we have all made, but there's been very little data out there that really tests that. And so we'll talk about that. So I'll give you just a little teaser here. The way that we go about creating trauma-informed and secondary trauma-informed organizations really does make a difference. So join my presentation. I'll give you the rest of the details and also a free tool that you can use to assess how secondary trauma-informed your school is. Thank you.
Thank you, Jenny. Thank you for all these introductions. I have some prepared questions for you, and then we will open it up to the audience. So if you could all turn your videos back on. Great, thank you. So Jim, starting with you, what are barriers that school leaders and staff face in implementing trauma-informed practices?
I mean, I think one of the things that I've noticed the most, and this is because we're out doing work with schools all the time, and sometimes you get these calls where it's like, we need to get all of our teachers trained in trauma by September 1st. And I think that tends to be one of the main things we run into is the pressure for surface training and not dedicating the time and resources needed to really look at systemic change. I think that's one of the main challenges that we look into, that sometimes the training, if we're not careful, it's easy for people to quote unquote feel sorry for kids, but to look at it from a perspective of improving discipline practices, behavior support systems, and instructional strategies, that takes a lot of time and a lot of support, a lot of resources. And I think that's one of the things that we run into the most is a check the box mentality if we're not careful, which is about just let's get everybody, let's say we've got this percentage of staff that everybody's been through this training, and not really taking the time and using the resources that it takes to really dig into how trauma can manifest for students and what practices we can put in place to support them. Because, meaningful change is hard. And even the right things are really hard to do sometimes. So that's what I see more than anything else, is that not creating the time and space needed to make those kinds of meaningful changes.
Great, thank you, Jim. And Marisa, how can school teams select and implement approaches that best meet the needs of their students and educators?
A great question, Hannah. I think a lot of times we jump into sort of selecting approaches or methods, or we go to a training and we get really excited about bringing it back, and that's all very exciting. I think we also have to take a bit of a step back and sort of think about what our knowledge about trauma and its impacts tells us, and operate from sort of a place of values. So selecting approaches, I think, is most effective when schools do so in a way that are guided by the values of trauma sensitivity or being trauma informed. So asking questions, like, how will this approach help our students feel safe socially, emotionally, academically? And will this approach help our students to have their needs addressed holistically? Are we really thinking whole child by doing this? Are we taking into account their academic performance, their self-regulation, their relationships with their peers and with adults who work in the building? And being guided by other questions like how will, sorry, my camera seems to be not working well this morning. Sorry about that. Taking into account also, will the approach that we're selecting help the student and all students feel more connected to our school community? Will this approach help us as a staff work together better as a team? Will it help us better anticipate the needs of our student population, the families we serve in our school building? So I think being guided by those sort of values type questions really helps us select what types of approaches we take.
And integral to addressing these barriers as well as choosing the correct approaches are the role of school leaders. So Jenny, what is the role of school leaders in implementing trauma-informed care?
I think, one of the things that I think that's very important is that school leaders are good role models. So beginning with the whole idea that if you're going to try and promote a new policy or practice in your school, that you need to practice what you preach. And you need to be able to show people the way by showing them how to do it in the tough times and in the easy times. And with secondary traumatic stress and creating secondary trauma-informed schools, that means something's really challenging for senior leaders and school leaders is really just this whole idea of, do I give myself permission to take good care of myself? Do people in my school see me paying attention to my level of indirect trauma exposure? Do I open it up for discussion and let people know it's okay to talk about the impact of these things so I can destigmatize it? So being a good role model is the first step. The second is being an honest broker. So to implement a secondary trauma-informed system in the school, what we're really asking people to do is bring people from disparate areas of the school together with community leaders and representatives to create change. And so there's some negotiation and there's some setting memorandums of agreement in place, and there's finding just the right people to come together. So I think operating in that honest broker function is important. And then the last thing that I'll say about this is they need to be a champion of both trauma-informed care and secondary trauma-informed care efforts. And that means really identifying emergent leaders, appointing them, empowering them. As you'll see when I do my presentation, the role of that champion is key in how effective the overall change is. So whenever we do a secondary traumatic stress change process, we start with the senior leader. We really get their buy-in, their commitment, and make sure that they are very connected with their champions teams and that they're empowering them and that they're learning from them and that they're also being transformative leaders along the way. So, role models, honest broker, champion.
Great. Well, now we are going to open up the questions to the audience. And we've received a couple, but we keep putting the questions in the Q&A as they come up. So this is for any and all of our panelists. Could you speak to how being trauma sensitive is good for all students, not just students who have experienced trauma specifically?
Sure, I can start that conversation, Hannah. I think, you know, the truth is it's likely that we will never know all of the students in our schools impacted by trauma. We may know some, either through the student sharing something or the family sharing something with us. But we'll never know all of the students, and the impacts of trauma can manifest in a number of different ways. So the creation of that holistic approach that when we're guided by the set of values that's good for students impacted by trauma, it's really good for all students. And so that school-wide approach guided by those values is the approach to take.
Maybe I could just add that, you know, sticking with this secondary traumatic stress theme, you know, when I was going through my clinical training, nobody ever talked to me at all about the impact of the work. And, you know, this whole idea of secondary traumatic stress, nobody mentioned this to me in my clinical training. It's gotten better over the years, but I think if we're preparing prospective teachers, then we really need to open up the space in the curriculum for them to educate them about secondary traumatic stress, about indirect trauma exposure, about how to take care of yourself, to do what we can to destigmatize the impact of this work and working with students that are trauma exposed. I think we want to change the conversation so that people don't feel like they have to hide. We need to give people tools from the very beginning when they go into their student teaching to self-assess and self-monitor, and let them know that if they are having a reaction or issues related to secondary trauma, what they can do about it, how to access resources. I think if we had a workforce that was prepared for these types of things going in, it wouldn't catch them so off guard. And be something that they struggle with silently. So I would really advocate for the integration of secondary traumatic stress education into teacher prep curriculum.
Well, Jenny, that segues well into one of our next questions, which is what strategies can we use to prepare teachers through their teacher preparation curriculum? Like, what are the concrete strategies would you recommend incorporating into the teacher preparation curriculum?
I'll take my turn. How about that? I feel like everybody's waiting. You know, one of the things I don't think we do enough of is we don't allow people to explore their own belief systems. We get so quick into telling people what to think. We don't spend enough time exploring where their thought process and values might come from. Exploring how, like, for example, we do a lot with behavior support systems. Like, where did you learn about discipline, and where did you learn about your values? And the main shift we start talking about, you have to start with your lens. And I think too often we just prescribe belief systems and values to people, and that's just a bad way to get people to buy into anything. So I think in teacher prep we could do a better job of slowing a little bit and spending more time around self-exploration, and then but that gets messy. But I think we have to address it at some point, or else we're just going to continue to prescribe belief systems and values to people over and over and over again, and then their resistance then people get resistant to that, and the separation then increases, and then it can become toxic and almost contemptuous, where there's like the people that believe they've got the values figured out and the people that are resisting against that. If I had to give like one simple answer, so I think we need to slow down and spend more time on helping people explore how their own values have come about.
I think just to add on to that, I mean, one of the things that we've seen in working with educators is, you know, this ability to sort of build this deep understanding of trauma and its impact really does open up sort of a reservoir of empathy, which can really help when there are misunderstandings between students and adults in the school. So as Jim was talking about exploring our own ways that we interpret different things, when you understand trauma, you may understand that a little bit differently. So that student that seems, disengaged, defiant, aggressive, we may take the lens and be able to apply it to see maybe that student is really doing the best they can to keep themselves safe, and they're using the only skills and tools that they have in that moment. And so then we can select a strategy that better meets that need for safety or connection or whatever it might be, and help the student develop, healthier ways to be in the school environment. So I think developing, an awareness and understanding of trauma and its impacts is also really valuable.
And maybe I could just, piggyback on that and say there is a whole science of trauma. And I think helping people understand the neurobiology of trauma and how exposure to certain events actually changes our physiology. It changes how our stress response is primed. So this isn't just trauma-informed care is not a byproduct of a permissive culture that some people are resistant to. We've learned a lot. We have functional MRIs, we have PET scans. We now understand more about what's happening in the brain. And so if you teach someone the science of trauma, they can begin to understand that this isn't just willful disobedience that children are engaging in, that this is actually a very natural and understandable physiological response to what they're being exposed to. And if we're going to counteract that or de-escalate that, there are tools we have to do that, but punitive, punishing, yelling, physical discipline is not the way that you turn down the stress response.
Think about families. Like, how can we involve families in the holistic trauma-informed approach?
I can jump in here. I feel like I keep jumping in first, but I think one of the critical factors in the creation of a trauma-sensitive, trauma-informed environment, and especially in schools, is that engagement of family voice and student voice, and really understanding, what the needs of students and families are, and then being guided by that in terms of the solutions that we offer. And we've seen a lot of examples of that just in this last school year and a half, I guess, this sort of remote learning experiment we were all forced into so quickly. But this idea that, jumping in and sort of beginning to solve that without involving families and not really knowing the reality of what it's like for them day to day doesn't allow us to create approaches and solutions that are very effective. And so that engagement of family voice, student voice is critical in the creation of trauma-sensitive or trauma-informed schools.
And we will actually have a session tomorrow specifically about engaging families as well. But one of our participants also said that they find the language of trauma can leave families feeling like they failed their child. So do you ever find this to be the case? And do you still use this language when creating a systemic approach that includes families and community?
I think that's a really good observation. And I think it's important that we recognize that if a student is experiencing trauma, that it's quite likely that the family system itself might be under stress and may be experiencing traumatic stress. So there's violence in the home. There's more than one person that's affected by that. So I think, being sensitive to that and kind of conceptualizing families in a way that we understand that, even non-offending caregivers will feel a certain way about what has happened. There could be guilt and shame and fear. So being really sensitive to that and helping people understand that, every effort they take to help their child get help, to engage in services is something that they can do that's very positive. And so, I'm a big believer in lots of labeled praises and very specific pointing out of strengths and trying to catch people doing good things and pointing them out. I think once you ensure the safety of the child, that it's not necessary as a school personnel to really be pointing out the things that they do wrong. It's really catching them doing the right things and getting them engaged with services and thinking holistically that maybe that mom or that dad or, the other siblings may need help also.
And one of our participants said that they like the idea of exploring our community's belief systems and early planning discussions, but facilitating that conversation can be very tricky and can also activate lots of emotions and potential trauma. So how do you recommend approaching opening up these discussions in a way that is productive?
One of the things we talk a lot about is being very thoughtful of context in discussion. I think one of the things that you see is that sometimes the most efficient way of doing something isn't always the most effective way of doing something. So, like if you have stakeholder meetings where there's lots of people there, I always think you got to be very cautious when you get into the values discussion. When you start talking about these kinds of things, you're much better off with smaller groups in trusted environments. I've seen some situations where I'm like, oh, that's just not going to facilitate well whenever we're doing a community trauma discussion. And I think you can share information that way, but you're not going to create a dialogue that in that way. Or if it does, it might come off the rails pretty easily. So I think being thoughtful of context and understanding it's a process, not an event, that exploring values in a community is truly a process and not an event. But understanding that a lot of times in an effort to move things forward quickly, people schedule events for process-based work. That's just my thoughts.
I think the principles of community-based participatory research are great ways to kind of pull a community discussion together, even if you're not doing research. But just the whole idea of like empowering, engaging community leaders to co-facilitate that conversation is a really good idea, and to let them define the agenda and set the tone and be there as a listener and observer, and not the authority that has all the answers. I think that's a great way to approach those initial conversations.
And one thing that I would add in terms of working with schools that have engaged in this work, often the sort of outward-facing terminology in terms of working with students and families is referring to their schools as a safe and supportive school rather than a trauma-sensitive or trauma-informed school. Just I think because of some of the stigma associated, it's a little more comfortable, I think, for families, the terminology that the schools use when referring to themselves as safe and supportive, which is a community that we all want to be a part of, right? It's a safe and supportive environment for everyone, educators, families, students.
Great. So unfortunately, we probably only have time for one more question. But other question we had are, what are some of the complications of effectively supporting those who have traumatic stress over Zoom in this remote learning situation? Like, how can we develop methods to identify and help these people in this new normal that we're in?
I think we've seen educators have to pivot to being really creative in terms of answering this question. I mean, I think one of the great concerns is some further disconnection for students who already may be feeling pretty disconnected from school because of the traumatic experiences they may have had. And so this idea of figuring out ways in the virtual environment that we can focus on relationship and connectivity, including times to build community, classroom community, school-wide community, are really hallmarks of trauma sensitivity, and especially important in this remote environment.
One of the things I'll mention too is I think continuing to allow our teams, like we do a lot with our leadership teams, and giving teachers the support and conversation about, we of course, multi-tiered system of support. And we're talking about how do we now organize student needs in the virtual environment based on our 3-tier model? What are our kids, who are our kids that seem to be doing well with our tier 1 approach, which is what everybody's getting? How do we identify what are our thresholds to identify students who clearly need a little bit extra, and who are our kids that need that as more intensive supports? And I think getting back to the teaming process, getting back to our data thresholds from tier 1 to tier 2 and tier 2 to tier 3 helps to create a more systemic process for our teams to support teachers, as opposed to what happens if we're not careful, it becomes this tidal wave of need, which then creates panic in teachers and creates, and teachers kind of feel like they're on an island. So it's kind of plugging back into those existing leadership teams that we should have been using prior anyways. That's why we felt like our schools with stronger leadership teams and PBIS implementation were ahead of the curve when this happened, because they already had data analysis, planning, responsiveness, and supporting teachers in those communication systems. The ones that didn't do as well were the ones that have the kids are like, what do we do with all the kids that aren't responding? And they didn't have a system to plug that anxiety back into.
And I might just add, for those kids that are, in tier 2 or tier 3, as Jim was mentioning, we are really concerned about safety and privacy issues. We've spent a lot of our time trying to deal with, kids that were already not safe, or their safety was questionable to begin with. And now, we have less contact with them, and they're isolated at home. We've got kids that were being engaged in commercial sexual exploitation and trafficking, and really trying to find ways to get kids in private places where we can talk to them and to ensure their safety while they're at home. So, we try all kinds of things like, where are you? I'm in my room. Can you show me your room so we can see who's with them? Can you go ahead and, walk over and shut the door? Things like that. If you want to have a private conversation, we ask kids sometimes to go outside or sit in the car. So we can have a private conversation, just so we can engage in questions that they may not feel, safe to answer in other situations. So we're having to get really creative too. I'm sure people that are on this webinar are facing some of the same kinds of situations and are trying to use some creative strategies as well to make sure kids are safe.
Well, thank you all. I'm sorry that we do not have time for more questions, but thank you for all of your thoughtful answers. And so what's next? We are now transitioning to 2 sets of concurrent presentations. So if you have more questions for Jenny and Jim, you will be able to ask them during their sessions. And we will come back as a full group for the keynote presentation at 2:45 Eastern. In the next session, Jim and Jenny will each host a 30-minute presentation. So again, too short, but trying to pack in as much information as we can to provide a deeper dive into the content they introduced during this panel. You'll be able to choose which topic is of most interest to you and join the session by following the links on the summit agenda on the website, which Nancy added in the chat. Just click on the More button under Concurrent Presentation Set 1 to find the specific link to these sessions. I know that both of these sessions are very interesting and it's hard to choose. So we will also provide we will provide a recording for these sessions on the summit website following this summit. In the afternoon, after the 30-minute presentation, we will have a 30-minute break, and we recommend that you try one of our mindful meditation moments. And at 1:30 Eastern Time, participants will have a choice of one of 3 presentations to attend. So these presentations will be slightly more interactive, in which facilitators will present a resource to support educators and students facing trauma and explore ways in which participants can implement these resources in real-world experiences. You can review the abstracts on the website and join the session that is most interesting and applicable to you. So our first concurrent presentation this afternoon will be on Handled with Care, creating a trauma-informed educational community, in which we will review strategies and programs included in the CSOC resources. We'll have a presentation on SHAPE, using a web-based tool to assess your trauma-informed approaches, created and facilitated by our colleagues at the National Center for School Mental Health. Or 3, effective school community collaboration and partnerships, again, using another CSOC resource. So if you have any challenges accessing the presentations or any issues throughout the summit, please don't hesitate to email csoc.relap@sri.com. And again, if you need a break, please access our mindful meditation moment recordings. So now we will have a 15-minute break as we transition to our next sessions. Again, if you want to access them, please go to the summit website, which Nancy put the link in the chat, and access each of the session of your choice, which will start at 12:30. And Nancy will stay in this room. If you have questions, you can also chat us. So thank you all for joining the opening session, and thank you to our panelists for a great introduction.